These videos were created for you to watch along. They'll teach you about client track so you know what's going on. So best of luck with all of your data. Now here's your HMIS system administrator. Hello and welcome to the new data standards training video. In this video we'll be going over the new changes coming to Client Track on October 1st, 2017. Most of these changes are HUD mandated, and that being said, HUD actually publicizes two documents that list the way an HMIS works as well as the new changes coming into the system. I always like to remind users about this document or both of these documents in case they are not aware of them. They are pretty easy to find. If you Google HUD Data Standards 2017, this should be the first search result. And if you go ahead and click on that, you'll see links to two PDFs. The first one here is the Data Dictionary. This one's more of a technical document, so if you consider yourself a technical person, I definitely recommend getting this. It also includes the project-specific assessment questions, such as the SSVF and RI assessments. The Data Standards Manual, on the other hand, is a little bit more user-friendly, but it doesn't include those project-specific assessments. But at the very least, if you download this manual, I think it will definitely help, because as you have questions such as what does this particular assessment really mean, or what's the best way to record this answer, or what's the best way to ask this question to a client, these two documents can really help you kind of see the how and why behind HMIS. So that being said, we'll go ahead and jump back into Client Track and begin looking at the new changes coming. The first thing I want to cover in this video are all the changes that will affect a project intake regardless of the project you are enrolling them to. So a little bit later we'll cover some project specific changes to project intakes. But again, right now we're just looking at changes that will affect all projects within the system. So I'm going to go ahead and start a project intake on my client I've got pulled up. The first change is a very slight one. HUD has just changed some of the verbiage of the gender options that you'll see here. However, the biggest change to this form is that disabling condition, which was normally right around here, has now been removed from this form and is now found on the universal data form, which is later in the workflow. It's been moved there because it will require you to answer it each time you do an intake, thereby doing a better job at recording disabling condition as it might change with the client. And we'll actually see on the universal data form in a little bit where it's been moved to. So I'm going to go ahead and continue on this workflow. You'll also notice on the family members form here, under this section here, there used to be disabling condition. It has been removed from here as well because again it will be found in the universal data assessment for each client. On the program enrollment screen, depending on what project type you are enrolling a client into, you might have an additional field here. So for instance, if you are enrolling someone into emergency shelter, this kind of gives you the basic requirements here to be addressed, which is a project start date. It'll automatically fill in the case manager and then your relationship to head of household. If, however, I chose rapid rehousing, I would also have a housing move-in date, with the idea being that the client would have a project start date when we first start working with the client, and then a housing move-in date when they actually get housed. This is actually not a new change here, and so for all you rapid rehousing people, you are used to working with this field and having to record project enrollments like this. The change comes in that now HUD is requiring all permanent housing projects to record a housing move-in date. So now if I go in and record a permanent supportive housing intake, for instance, that is still going to be a required field. It will just be required for self, but it will be required. So basically, any projects now that provide a bed besides emergency shelter, transitional housing, or safe havens have a housing move-in date that's going to be attached to the project enrollment. We have included some HUD verbiage up here. This is actually straight from the data standards manual that I mentioned earlier in this video. But if we look up here, we can see what project start date represents now. So for permanent housing projects, it is the date following application that the client was admitted into the project. To be admitted indicates the following factors have been met. 1, information provided by the client or from the referral indicates they meet the criteria for admission. 2, the client has indicated they want to be housed in this project. And 3, the client is able to access services and housing through the project. The expectation is the project has a housing opening or expects to have one in a reasonably short amount of time. So what that means for you permanent housing projects is you will be enrolling people perhaps before they actually get into one of your beds now. And so when you do that, you will record the project start date as the date you are enrolling them into your project. And then later on, when they actually get housed, here's where we would add that housing move-in date. And I will show you in a little bit how to go back and add the housing move-in date after the fact. There's a couple benefits, I think, to this. One, it will allow projects to work together better. So, for instance, if a client has consented to share their information and a client comes to your agency, you will be able to see if there is maybe a permanent housing project that's already working with them. Maybe they haven't actually got housed yet, but they have been enrolled and you guys are just waiting on, or the other project is waiting for a bed to open up. So this will allow people to work together better. Also, for your project specifically, it would allow you to be able to see some good data, such as how long does it normally take from when you first enroll someone into your project before you can actually get them into a bed. So there's some good data that comes along with this change. We'll go ahead and continue on in the workflow. This brings us to the universal data assessment. So here's where I was talking about disabling condition is now going to be listed right here. Also, the housing status field, which was right around in this area, that has been removed now. That's where it had the 4 different categories of homelessness that you had to record. That is no longer a part of HMIS. HUD has taken that out. Under type of residence, they have reworded one of these options here. So if we look at, or actually 2 of these options, if we look at this permanent housing right here, they've added the other than rapid rehousing. And on this one, rental by client with other housing subsidy, they've added including rapid rehousing. So that just gives you some direction on if somebody was coming from a rental house where they were getting rapid rehousing funding, then you would record that like that. So we just want to make sure when we're assessing clients that we are asking these detailed questions and recording them as such. Also, I want to just do a quick note on this button here, the default client's last assessment. When you click this button, and if you're familiar with this button, it brings in information that has been previously recorded for this client from a different enrollment, just as a way of kind of saving you some time. But when you use this button on this particular form, the Universal Data Assessment, it will just bring in disabling condition and health insurance. It's not going to bring in the living situation questions. And the reason being, and there's actually a note up here about it, is because this always should be a real-time data collection field. This is going to, need to be asked every time you enroll a client. And we want to make sure that this is always updated information. So that's why this button does not bring in these fields. And we've had some users reach out to us and ask us. So I wanted to cover that. Also, this button does not bring in any project-specific assessments either. So for instance, if this were an SSVF enrollment we were doing, there would actually be some additional fields here. This is not going to bring in that information either. It's just going to bring in, again, the disabling condition and health insurance, just like we see there. So I'm going to go ahead and answer these questions so we can go ahead and continue on in the workflow. This will bring us to the barriers/special needs form. So something you'll notice here is disabling condition is also listed here. Now this is actually just a shortcut to the question from the universal data assessment. But there is a very particular reason we have included or brought over this question to be on this form as well. So for instance, for this client we said there was no disabling condition. But if I were to go in here and say they did have a particular barrier, and I were to say the condition is indefinite, and then try to click save, we're actually going to get a warning. So we can see here there's one row in the result set that requires attention. If I hover over the exclamation point here, it says you have identified a special need as indefinite. This conflicts with the client's disabling condition status. Please change the special needs status so that it does not conflict, or save this form again to update disabling condition to yes. So what this is saying is these two questions, they kind of contradict each other, right? Because we're saying this client does not have a disabling condition, but then we're saying there is a barrier and it is indefinite. And if any of these are ever marked yes and the condition is marked as indefinite, then disabling condition should be a yes as well. And so the reason we brought in this question here is just so that you can go ahead and update it here without having to go backtrack and say, oh, you know, I should have recorded them as having a disabling condition. Let me go record that. Well, we've made it easy for you by just doing a shortcut here to this field, and you can go ahead and update it here and continue on. So we'll go ahead and move right along here. Domestic violence is a form there's actually no changes on, so we'll continue on. And then finally on income, under non-cash benefits, you're going to see two options here that have been removed. So the first one is Section 8, public housing or other ongoing rental assistance, and temporary rental assistance. So HUD no longer wants these a part of non-cash benefits, so they have been removed. We did leave them on here, as you can see, but we just have them crossed out. The reason we did this is just so for historic records, if you ever need to pull up and see somebody's non-cash benefits, you will be able to see these two options. However, when doing intakes, you will no longer be able to record these two fields here. So if I were to even check these and do save, it's not going to save this. So just be aware of that. That being said, that actually includes all the changes that are going to affect all project types. The other thing I do want to cover with you is how to add that housing move-in date. Again, that's for those permanent housing projects. So if I were to go back to the dashboard here, we can see here the enrollment we just did. And there's two different ways you can kind of get to that housing move-in date field. One is one you probably all are familiar with. That's the edit enrollment workflow. If I click on that, it's going to kind of walk us back through the workflow. So it will bring up the basic client information first, which we would do no changes on, and then skip the family members, and then it will show that program enrollment. And here's where we could go ahead and add that housing move-in date. So let's say we enrolled the person on the 18th and we provided housing on the 20th. We'd go ahead and click save. And because that's the only field that we need to update, we don't really need to continue on in this workflow. So it would then be safe to go ahead and cancel the workflow by hitting this button and then click yes. A little bit faster way of getting to that question is if you click the little action button and click on Update Annual Assessment, it'll actually take you straight to that form, which would then allow you to key in that number or edit it if you need to. Go ahead and click Save. And then if you don't need to do an annual or during program enrollment assessment, then you can go ahead and just cancel out of that workflow as well. So that's just a little bit easier way. And that is going to conclude all the changes to the standard project intake. This next change I'll be talking about just applies to projects that are required to do annual assessments, and that is based on the funding that you get for your project. But for those that do have to do an annual assessment, HUD has changed ever so slightly the annual assessment requirements. And so hopefully we're all aware that if we are required to do an annual assessment, that always has to be done within a 60-day time window of the anniversary of the client's enrollment. And that hasn't really changed, or at least not changed for the head of household. However, it has changed potentially for a family member if a family member has been enrolled on a different date than the head of household. So for instance, on this enrollment right here, I'm going to go in and do an annual assessment and show you what I'm talking about. So here we can see that the head of household, they were enrolled on 9/14/2016. It's mid-September right now, so I should be doing an annual assessment on this client. And if you note here, the child actually came in later. Child did not come in till December. Well, HUD's new guidance and requirements for annual assessments is that you do annual assessments for the entire family based on the enrollment date of the head of household or self. So all you need to do is, or remember, is that when you do a annual assessment on the head of household, you would go ahead and do it for all the family members regardless of their start date. In regards to the exit process in ClientTrack, there's only one change coming with the update, and you might not even notice it if you did not know to look for it. So I want to go over that with you real quick, and it's under the destination question when you exit somebody. So there is one brand new field here, and that is the rental by client with rapid rehousing or equivalent subsidy. So if you are exiting someone and they are going to a rental house and they are getting rapid rehousing dollars, you want to be sure to, one, you're asking the client that, and then two, of course, recording it appropriately here. And then they've also reworded one of the options up here, and it is the permanent housing option here, and it says other than rapid rehousing. And so now permanent housing here would not be what you want to record for rapid rehousing projects. So as long as you are aware of these changes and are making sure we're asking those questions to the clients and recording it properly, we're good to go. So far we've covered the changes that will affect all projects within the system. Now we are switching over to just project-specific changes. So the first changes we're going to look at here are ones to do with SSVF projects. So the first one you'll note while doing an intake is under the Universal Data Assessment form. This is a pretty small change, but if you look at VAMC station number, you'll note that this is now a drop-down list, while this used to just be a text box where you would type in a number. So now that this is a drop-down list, this should make data entry a little easier and also help out with data quality issues. And speaking of data quality issues, if you ever need to go in and modify a universal data assessment for an SSVF enrollment that was created before the change, if you see option not in list listed right here under this field, what that means is whatever information was keyed in here previously was not formatted properly. And to be able to edit anything on this form and save it, you would need to go ahead and correct that, and you could do that very easily just by clicking on the drop down list, choosing the appropriate number, and then it would let you go ahead and save. The next changes in the system you might not even notice, but here on veteran information, this is a form you're used to seeing, data you're used to collecting. However, the way it's recorded in the system is a little different. So previously, every time you did an enrollment, you would do a new veteran information assessment. So all this information would be recorded. And so this also means you could have multiple veteran assessments associated with a particular client, depending on if that client had been enrolled in multiple SSVF projects. Well, now HUD has changed that logic where they only want one veteran assessment tied to one client. So in the same way that for every client there's only one field where you can go in and type in their social security number, there's only one birth date they have, only one name they have, they only have one set of veteran information. And so this also means that if they already have veteran information recorded in the system, maybe by a different user, a different organization, when you go do a enrollment for this client, then this information will already be here. Now it will let you modify it if maybe it was recorded incorrectly or maybe it has changed since then, so you can go ahead and change it, but just know it will automatically pull up. Also, because of this change in logic, we added a new shortcut button over here to get to this information. So if you look at the menu on the left, you'll see HMIS 2017 Veteran Information. And if I click on that, it will always take me to this form where I can see this information and change it if need be. The next change is the connection with SOAR field here, and this will just be something that you will have to answer for heads of household and adults anytime you're doing an intake, a annual assessment, or an exit. So just be prepared that you are asking this question to all heads of households and adults. And the last change is actually something that was removed from SSVF projects. It's something that VA no longer uses, and that is the use of crisis services. That was where it asked about emergency room trips, and so that is no longer part of HMIS, and so you will not see that. And that concludes the changes for SSVF projects. For RI, there aren't any new assessment questions added for at least the intake process, but there are a couple of changes. The first change you're going to note while doing an intake is on the RI entry assessment under referral source. This used to list 45 different options here. HUD has now streamlined that down to these 15, so that should make your job easier in regards to data entry. They've also removed the sex trafficking and labor exploitation assessment from entry, and now that is just part of the exit process, if you're familiar with that form. And we'll see that form in just a moment. Those are the only changes in regards to intake. Also, for outgoing referrals, which you were used to recording through this process right here, HUD is no longer requiring outgoing referrals for RI projects, so you no longer have to record those. We have decided to leave the functionality in the system, so if you want to continue to record those, that would be fine. You can do that, but again, it is not anything that is required anymore. And while there hasn't been a lot of changes in regards to the entry process, there are a few changes and new forms to the exit process in HMIS. So I'm going to go ahead and fast forward through some of these exit assessments you're already used to so I can show you the new changes. So this is what I was talking about earlier. So this is the sex trafficking and labor exploitation form. This was previously just recorded on intake. Now it's recorded on exit. So we want to make sure we are asking these questions as we are exiting our clients from our RI projects. Also, we have a brand new form here for counseling. So we want to make sure we are gathering this information found here and recording that into the system on exit. There's also a new safe and appropriate exit form here, and we can see these questions here. So these are all required as well. We want to make sure we are capturing that. Another thing that has been changed or kind of removed and repurposed from the exit process is the aftercare plans. So HUD used to have a aftercare/exit care question where it asked if aftercare was expected to be provided, and you would answer that question when you were exiting someone. Well, now instead of that question being if aftercare was expected to be provided, they want to know was aftercare provided. And so this is going to be recorded through a post-exit assessment. So this is going to be after you've already exited someone. They're going to then be later on a different date assessed if they got aftercare or not. So to record that, this is going to be a new button that's in Client Track. If you click the little action button beside the enrollment of someone that has already been exited, so this is the person that we just exited. As long as it's a RI project and they have been exited, you'll see this button here, RI Aftercare. And I'll go ahead and click on this button here. A thing to note about this is this must be dated within 180 days after the project exit date. So it can't be longer than 180 days. So we would go ahead and let's say we did a checkup on them on the 16th, and then we would just answer if aftercare was provided, and then also if we're answering yes, how did we follow up with them? And then we'll go ahead and click save and finish. And that is how you record that new post-exit assessment. And that is everything in regards to changes for RI. There's a few changes in regards to Vash projects. One is the HUD Vash voucher tracking form, which is on the screen here. This will come up anytime you're doing an intake or an annual assessment or exit, and this is just recording the voucher change status. So you'll see the different options here. This will just be asked for the head of household / veteran. So we want to make sure we are recording this information and gathering this information from the client each time we're doing an assessment. Then the only other change for Vash projects has to do with when we exit somebody. And I am going to pull this up through a shortcut, but this will automatically come up in your workflow when you're exiting somebody from Vash. And it is the case management exit reason. So this is basically why you are exiting this client. So you will just have to answer that. So be familiar with these different options and be sure we're getting this information from the client. And that's going to be the only changes to Vash projects. And finally, on street outreach projects, there's only one change, and it's a pretty small change. It is found on the contact form, which you'll find built into your workflow. The contact service, after you select a particular service for this, you'll notice this field pop up here. There used to be a field that said location of contact, and it had a drop-down list of different location types. That's been replaced with this, where it just says staying on streets, emergency shelter, or safe haven. And this is just a yes or no, or worker unable to determine question. So you just need to answer that. It's a little bit simpler than the old question, so you shouldn't have a problem with it. And that actually concludes all of the new changes coming out for the system. So like I said, this will hit October 1st, 2017. So look for it on that date. If you have any questions as you're going through this training, I recommend go ahead and submitting a ticket even though the changes are not in the system. If you have a question and you just want to make sure that you are prepared, definitely go in and submit a ticket on that. You can always submit a ticket by clicking on help and report an issue or ask a question. And I just ask that if you're submitting an issue or asking a question in regards to the new data standards, just be sure to put new data standards somewhere in the subject line on the ticket. And that goes for submitting a ticket now before they actually go live, and then also ongoing. If you have any issues with the new changes, definitely submit a ticket, and again, use that new data standards in the subject line. Thanks.